Hi, my name is Lena Kane, and I'm a speech-language pathology student at Sacred Heart University. Today I will be discussing prelinguistic skills and their importance in early intervention and preschool speech-language therapy. Specifically, why it is important for parents to target these skills in their daily lives as well. To start off, what are prelinguistic skills? Prelinguistic skills refer to the skills that children develop prior to communicating verbally. Typically, this development starts to occur during the child's first year of life before they start producing their first words. However, in children with speech and language delays, these skills are often delayed as well. Some examples of prelinguistic skills include joint or shared attention, a variety of receptive language skills, such as comprehension of vocabulary and following directions, imitation, including both physical imitation and verbal imitation, initiating interactions, using gestures, turn-taking, responding appropriately to people and events in the environment, for example, looking up when an adult enters the room, and play skills. Why are prelinguistic skills so important? The development of these skills are the necessary first steps in acquiring and using verbal language. So working on these skills increases child-initiated communication and often reduces child frustration when communicating as well. As a result, these skills are often the focus of early intervention and preschool speech-language therapy. The good news is that it is very easy to target these skills in natural environments. And it is also very easy for parents to implement and focus on these skills in their daily life with their child as well. So how can parents work on them? There are a number of direct therapy programs that target the acquisition and development of prelinguistic skills. One such therapy program is prelinguistic milieu teaching, otherwise known as prelinguistic milieu training or enhanced milieu teaching. A large focus of early intervention speech therapy is coaching and training parents and caregivers on ways to incorporate aspects of PMT or similar therapy techniques in their daily life in order to ensure that parents are confident addressing these skills with their children on a day-to-day basis. Before I'll focus in more specifically on PMT, I would like to address a potential concern that parents, in my experience in early intervention settings, would often bring up. And that is when we were targeting some of these prelinguistic skills, such as shared attention or gestures, parents would become concerned that we weren't putting as much emphasis on verbal language, such as imitating actual words. But it is important to know that these nonverbal skills are the point of targeting them is to encourage verbal communication. Overall, as a parent, it is highly important that you work with your early intervention provider in order to make sure that they are implementing a therapy plan that you are comfortable with and that you are comfortable implementing these therapy strategies at home as well. I would just like to quickly focus that even when targeting nonverbal communication skills, you are encouraging verbal communication as well. To focus back in on prelinguistic milieu teaching, PMT is an intervention that combines behavioral principles and naturalistic strategies to target prelinguistic skills. It is a very child-centered approach, and it uses the child's specific interest to initiate opportunities to model news language in a natural environment during their daily life. Some common PMT strategies include placing desired objects out of reach, or in general, manipulating the environment to encourage communication. For example, in my experience in early intervention, we would often have the child's parents put preferred toys in boxes or bags that the child cannot access on their own. This requires the child to initiate communication in some way, either gesturally or verbally, in order to request use of the object. Utilizing verbal and play routines was also a very common strategy that we used in early intervention. This could be during daily routines such as sleep time, bath time, eating times, songs that the child is familiar with, or play routines such as ready, set, go. Taking turns during play also is a PMT strategy that encourages opportunities for the child to communicate, and in general, expanding and elaborating on the child's communication attempts. So if a child is reaching for an object, acknowledge that they are communicating with their gesture, but providing a verbal model for "I want that" is a way to expand and elaborate the child's communication attempt while still honoring the fact that they are communicating already. Now I'm going to review some of the evidence base for PMT, specifically the evidence base for parent implementation of EMT. So this first study, conducted by Kaiser and Roberts in 2013, the purpose was to compare the effects of PMT implemented by therapists only versus a parent in combination with therapists. And the outcome suggested that PMT had a greater effect when both parents and therapists are implementing the treatment. Because not only does this increase the amount of daily hours that the child is exposed to these treatments, both during direct therapy and at home, but parents are also great facilitators for language because they spend the most time with their children. This next study, conducted by Wright and Kaiser in 2016, reviewed the effects of a teach model, coach review model in teaching parents PMT strategies. So the therapist would teach a strategy, model it for the parent, watch as the parent implemented it and provided coaching, and then reviewed with the parent their implementation at the end. The study concluded that the implementation of this parent training technique increased the parents' effectiveness in implementing the PMT strategies on their own, and overall increased their confidence in using the PMT strategies during their daily life when the therapist was not present, and the accuracy of those strategies as well. And this last study, Dubin, Lieberman, Betts, Ayers, and Zukowski, 2019, focused on the review of effectiveness in PMT in a preschool setting. A lot of the previous research focuses on the use of PMT in early intervention settings. However, it's important to note that some of this preliminary studies encourages their use with verbal children at the preschool level as well. So the results of this study indicate that PMT is effective at the preschool level, and therefore it enhances previous research that has focused on the use of PMT in early intervention settings. So not only is it beneficial to utilize some of these prelinguistic strategies to support verbal communication in our toddlers and babies, but also to continue utilizing these strategies in our more verbal preschoolers as well. So to conclude some takeaways, prelinguistic skills are important and sometimes misunderstood focus of early intervention and preschool speech therapy. Parents should be encouraged to ask questions and attempt speech therapy techniques outside of direct therapy time. And in fact, some research suggests that this increases the effectiveness of those therapy techniques overall. It is very important for early interventionists to encourage parent involvement and to ensure that parents understand and feel comfortable utilizing therapy strategies during their daily lives. A huge component of early intervention therapy should be directly coaching the parent on how to utilize these strategies and to ensure that they feel confident using these strategies with their children when the therapist is not present. And overall, there is much more to communication than just verbal language, and these prelinguistic skills are a great example of that, of how nonverbal communication skills encourage verbal communication overall. Thank you.